While over 80% of the country is double vaccinated, the majority of people in this room are not.
His life choice of not having a vaccine is probably very apparent to him, unfortunately.
How old is he?
He's 40s, I think. Yeah, 45.
The intensive care unit at the Royal Free Hospital is nowhere near as packed as when I last walked through the same doors exactly 1 year ago. Then there were more than 90 critically ill COVID patients spread across the hospital. Now there are just 10.
With a poor-looking CT scan, you're functioning very well.
But they do seem relatively young. Jassim Nissi is 48 and he's been in intensive care for over 2 months.
You see, my body is shaking because very weak. And my hand, when I want to eat, is shaking. All my body shaking. And feel very cold, freezing.
Did you get vaccinated?
No. I was because I was lazy, to be honest with you. Every day I said tomorrow. A big mistake.
The risks of not being vaccinated seem to speak for themselves on the intensive care unit.
Basically, people are getting sicker if they don't have the jab.
It does seem that way. It does seem to keep you out of the intensive care unit, which is a benefit for that individual, but it's also a benefit for the other patients you've seen today. It allows beds to be available for people who are having cancer operations.
In the Royal Free's Cancer Department, they're short-staffed and dealing with a backlog of operations. Here, I speak to Marion, who didn't want to appear on camera, but her diagnostic delays in another hospital due to COVID means she's now facing a more complex procedure.
The delay is the appointments at the hospitals.
Yeah.
And then a delay waiting for scans. Yeah. You have to wait for the scan, and then you have to wait for the result to your GP or to the hospital appointment. And these things, I appreciate it, all takes time.
Yeah.
But there are all these delays.
Do you feel like that those delays are a result of, the NHS has been under a huge strain because of COVID?
Yes.
Yeah. This consultant surgeon has just come from seeing a patient who delayed coming to hospital after being referred by his GP because he was worried about catching COVID.
Unfortunately, when we eventually got round to seeing the patient, his cancer had already spread. So we're now dealing with a young patient in his mid-50s who perhaps had we seen in a year ago could have offered him curative surgery. We're now dealing with palliative care.
Yes, in between those first two.
The cardiology department has the same message: don't delay if you have a severe problem. But there are pressures here too. The patient here clearly needs a post-operative bed, but with the hospital at full capacity, there are competing needs.
We have a patient in A&E is waiting for a cardiac bed, and we have currently this patient behind us that is undergoing a cardiac procedure, and they are both allocated to the same bed on the ward. So we are waiting for the bed managers in the hospital to let us know the bed status upstairs.
And so while COVID numbers are down, especially in intensive care, the pressure on staff remains intense.
We've got a big issue with burnout because actually, even though we're not at those high numbers, we've never actually gone back to sort of normal ICU pre-COVID. That's never really happened. So even though we're sort of back to more manageable numbers of patients, we're still very, very stretched.
The Royal Free, full to the brim, short on staff, but in some ways, very stretched, is a relief. Jason Farrell, Sky News.